You're listening to The Art of Imperfect Adulting. I'm your host, Amy Stone. Here, I share stories from real people navigating the adventure that I call adulting. Are you ready? Me too. Let's do this. Today, on this episode, I'm pulling back the curtain on a topic that affects millions of women, but somehow still lives in the shadows of conversations. Perimenopause. My guest is Suzanne Greiner, who has 26 years of nursing experience, but she still struggled in navigating her own perimenopause journey. So in this episode, we're breaking down the walls of silence around menopause and getting super real, very matter of fact, about many, many things. So grab your favorite beverage, get comfortable, and join us for an honest, empowering, and sometimes humorous look at this transformative stage of life. Let's do this. Suzanne, welcome to the Imperfect Adulting Show.
Thank you for having me. I'm excited to be here.
Me too. Me too. All right. So are you ready for a fun chat?
I'm always ready for a fun chat.
I love it. I love it. I love it. So this is going to be so much fun. The topic you pitched me is talking about perimenopause. Does that sound correct?
That is correct. It's the fun, chaotic world of perimenopause.
I feel like we should give it a pause. And any men who are not interested in this topic, who accidentally tuned into the podcast, and just be like, "Oh, skip."
Well, I think it's good for them to learn too, because if they have a sister or a spouse or someone else close to them going through it, I think it's so important for them to be a part of this, because then they understand that world a lot more than maybe they did before. So
100%. You're talking to somebody who was raised by a single dad in most things. So I have many, many adorable stories about the not menopause, because he was not around for that, but puberty with me.
Yeah.
And so and he handled that like a champ. So we are going to jump into this, but I do want to give you a chance to tell us being me and the people who are listening and watching, a little bit about yourself. What part of the world do you call home? And while you're talking to us, tell us as much or as little about your family as you want to.
Okay. Well, like you said, my name is Suzanne Greiner. I live in the suburbs of Denver, Colorado. So I've been out here for about 17 years. I've been a nurse for 26 years. And I have three teenage children that it's been fun. it's wonderful because it's always something learning constantly with them. And I'm a single mom, so I've been divorced for about 7 years. And so kind of that's my backstory of like who I am. But then, yeah, I've just going into perimenopause just within the last year and a half, that's really been eye-opening for me, just being a nurse. And then I actually about 3 years ago, I became a board certified nurse coach. This was kind of like that post-pandemic, what I want to transition to after the world went crazy, and really redefining what I wanted to do. And I absolutely love the idea of coaching, especially women going through different transitions in their life and just well-being, like their whole person, and not just like, we're looking at your disease, we're looking at the whole person. So I did a lot of extra training for that. And also some functional medicine training. So I always look at the root cause for a lot of different things when I work with my clients. So it's just been a fun life, I guess you could say. A lot of craziness, but overall, it's been a really fun life.
So we could have talked about a bunch of choices and changes when we set up this, but so there's a lot in here. And I did have questions because you put in your information. So I knew you were a nurse, but I have some follow-up questions about that because I think that's very interesting. So as we record this, I think I'm a touch older than you. I'm 51. When I was a kid, I was told you're never supposed to ask a woman about their age, but that has never made any sense to me.
Funny.
I've always been super upfront about it. I'm like, this is how old I am. I don't care. I feel like the entire world right now is talking about perimenopause and menopause. And I don't know if that's because it's age appropriate for me, but my history as an individual who grew up like as a person who was born with a uterus, right? I don't think that anybody talked to me about perimenopause. I don't think I heard about perimenopause until I feel like it's a new word, but I don't think that I heard about menopause outside of like a very clinical description in like middle school health class, whenever we have that class that's like, this is your body and this is how you shower.
You're lucky that you got that.
Right. Well, exactly. So, and you're a nurse, so your experience with like information is definitely super different than mine. But what did you know about perimenopause and menopause before you discovered you were dealing with it?
I knew it happened to
Right.
women
It's
as
a
we
thing.
aged. It was like it happened.
Happens to other people.
But it was always this hush hush topic
Yeah.
because I feel like we live in this world that we put women on this pedestal of like they can't age. They are most seen like out in the world more when they're like able to have babies. We celebrate everything that they're doing as a woman having babies and like all this other stuff. But then we kind of forget about her as she ages. And so I remember when my mom, she had a hysterectomy, and I believe it was in college at the time, but it was just like I noticed the mood swings. I was just like, oh, okay, just a little bit more, but she never spoke about it. But she had a hysterectomy, so it was a little bit different. And I also knew that she had gone on some hormone replacement therapy after the hysterectomy. But then this big WHI study came out in the early 2000s, and she's like, threw it out in the trash. So
Right.
I just knew a little bit about it. And even as a nurse, when I was working bedside nursing, I would train, actually would teach this class, Healthy Living with Heart Disease. And that was like the number one topic. These women that had heart disease that came in with coronary, like they had blockages in their heart, and that we, in the hospital would open up, that we would teach them this class. And that was their number one question, like, is hormone replacement therapy safe for me to use? And I'm like a 22-year-old nurse at that time. Like, I don't know. So like, there's not a lot. I mean, there really wasn't a lot of like, even given to me in nursing school, not a lot of information. We were taught that yes, women go through menopause, but a lot of our training was on the OB side of things of like when women are having children. But yeah, a lot of the training is not out there or hasn't been out there for several years. And so it's been kind of hush hush until just recently. And I think Gen Xers and older millennials were like, this is ridiculous. Why should we be living in silence when this is like has a toll on your body? There's a lot of
Yeah.
longevity consequences that happen if we're not informed. So we're not going to be quiet. So I think we've created this buzz lately about going through perimenopause and menopause, which is amazing, which is going to be so helpful for our daughter. I have, two daughters. Like, I know it's going to change their generation of understanding this, and that's important to me.
No, 100%. And you knew that story from your mom.
Mhm.
I actually didn't have that history from my mom or my grandma.
Yeah.
So it was like a wild card. And so it was, and it cuts off the
Right.
sort of generational path of like, so for me to hear about it, it's going to either be, from a friend or, somebody like mainstream, right? So, all right. So it is really interesting to me because I was going to, that your mom had a hysterectomy. The focus on my show here, right, is stories about choices and changes and the directions and so on and so forth. And so I can sort of broadly classify changes and choices into two ridiculous categories of things we choose and things that feel like they're chosen for us. Like I choose
Right.
my breakfast, the weather is not my choice. And perimenopause and menopause is almost always is something that we don't have a choice about. But the one exception is women who, well, maybe there's more. The one exception I know about is women who go through a hysterectomy, which is like
Right.
an immediate change, right? So you can correct me if I'm wrong about that, first of all, and then take me through the story of what was going on with you when you were like, well, hello, something is happening.
I think that it's really important. 100% of women, if you have the privilege of being able to hit midlife, 100% of us will go through perimenopause and menopause, and we will hit it at varying degrees. Like your story is going to be different from mine, but I think the most important thing is we have to really pay attention to our bodies more than ever during midlife,
Yeah.
because our body is always going to be telling us something, and really paying attention to our intuition or gut feeling. Like you live in your body 24/7. When you start feeling it off, like something's not right, that's the start of like, let me guess. But yeah, so you can have surgical hysterectomies. It depends on if they take out the ovaries or not. If they do take out the ovaries, that's like, as soon as you wake up from anesthesia, you're going to feel menopausal symptoms. But if you don't take out the ovaries, it can accelerate your menopause transition to about 4 to 5 years sooner than maybe
Okay.
it was. So you still have a little bit of a leeway time. But anyway, so my story started a little over a year and a half ago. And I just like the common feeling that most women feel like when they're in perimenopause is like, I just don't feel like myself. And I was starting to feel this way. And I was just like, I was trying to put my finger on it. Like, I'm a nurse, so I'm like investigating, like, okay, what's going on? And it started off with joint pain for me. And I was just like, man, I'm a hiker. I love hiking trails in Colorado. So there's some elevation and everything, but hiking 3 to 4 miles, I was taking a good like 2 days to recover because I had so much joint pain. I'm like, oh my gosh, what is going on with me? I'm like 47 at the time. I feel like I'm 87 and like trying to get out of the bed in the morning. I was like, holding on to the side rail of my stairs just to come down the steps because I was so freaking stiff. And I'm like, okay, well, like maybe I just need, like, maybe I have some inflammation in my body. Maybe something's going on. So just like, okay, what's going on? And like, maybe there's some supplements. I was just like investigating everything.
Right.
And then I started to notice this weight gain. I had gained almost 25 pounds in about a 9-month period. And
That seems to be pretty common.
Yes. And like, I hadn't changed my diet. I hadn't really changed my exercise routine. Yes, I was more stiff, but I was still like working out and doing all the stuff. And I'm like, okay, this is there's something going on. And that's what, like, to me, I'm like, there might be some hormones. Maybe my thyroid's off. Maybe like my cortisol is too high because I'm stressed or something. But I'm like, I don't feel as stressed.
You're getting the ads on TV that was like cortisol detox.
All of a sudden these like, my algorithm starts changing on social media. So
right, exactly.
And then when I started to get brain fog last fall, that's when it was like the trigger for me. I'm like, this is what dementia feels like. I'm like, I think I'm in perimenopause. Like it was just like a slow decline over time. And then it was like the floor gave out and was just like brain fog. And then before I knew it, I had like 17 different symptoms because I started doing a bunch of research on perimenopause. What are the symptoms? Like all this stuff. What's the most debilitating symptoms I'm experiencing? And I was just like, oh my gosh. I'm like, okay, well, I have my yearly appointment coming up with my PCP. So I'm just going to approach her about it. Well, a couple of things. PCP are not like the typical person to really address perimenopause, menopause. So for anyone that's listening, it's usually an OB-GYN or someone that specializes in hormone therapy, like is super important. But PCPs, they're inundated with so many other things. So and typically you have a 20-minute appointment with them. So it's like a lot in a little bit of time. But I went into my appointment super excited. I put a lot of weight on that appointment to find solutions because I was feeling so miserable. Like by the time I got there, I'm like, my sleep was like, I felt exhausted. I was going to bed at 7:30 at night. I was irritable. Like all these symptoms start compounding. Like that floor gave out, or what was tolerable was no longer tolerable in my life anymore. And so she walked into the exam room and she said to me, she goes like, what brings you in? Like, it's your yearly appointment. What's new? And I'm like, oh, I think I'm in perimenopause and here are my 17 symptoms. And I think she was kind of like, oh my, that was a lot. Like,
thank you.
So she asked me, are you still having your menstrual cycles? I said, yes, I am. They're a little bit different than they were. I have an IUD in place. So it was like a little bit different.
Right.
But yes, I'm still having my cycles. And then she goes, are you having hot flashes? And I said, no, out of all those 17 symptoms, not one of them was a hot flash. And I think that's so important to recognize because a lot of women may have hot flashes and a lot of women may not have hot flashes. So,
I heard a statistic that it's actually a pretty small percentage of people that get hot flashes. But have you seen the video going around of the lady at the football game having the hot flash?
Yes, I've actually had.
That's such an amazing video.
I've had like 2 screenings and we've had like 120 women show up. It's been so fun. But anyway, so she basically goes, okay, well, I have 20 minutes to spend with you. I can either talk to you about perimenopause or I can talk to you about your yearly appointment, but I don't have time to talk to you about both. And I'm like, in that moment, my heart sunk because I put so much weight in finding that solutions for me. And I was just like, and I just started to tear up. And she goes, okay, well, tell me your symptoms. And so I told her all my symptoms. She found the increased anxiety and she found brain fog. And she's like, oh, I can give you an anti-anxiety medication that will treat the new onset anxiety. And it may kind of help your brain fog. And I looked at her and I said, absolutely not. I'm like, you're treating a symptom of perimenopause, but you're not actually treating the root cause of my hormone fluctuations. And she refused to do any lab work for hormones or anything like that. And so I left that appointment. I sat in my car and I cried because, I've been a nurse at that point, like it was 25 years. And I'm like, oh my gosh, now I finally get what my patients have felt like for years, not being listened to by their providers. And I would teach my patients and I would advocate for them. And then I felt like, oh my gosh, I'm like this, the tables are turned on me. And I'm like, if I felt this way, how many thousands of women are feeling this way, leaving appointments and not finding a solution, just frustrated, and they just feel like crap.
Yeah.
Made a promise to myself. This is that that choice of making a change in my life. That was a defining moment. I made a promise to myself. I'm like, I never want another woman to feel the way I'm feeling right now, because this is no woman should feel this way. No woman should feel alone while they're going through this journey. No woman should leave a doctor's appointment not having solutions. And so I transitioned my business to really work because I was working with women in transitions before, but this really focused more on the perimenopausal journey of a woman, because that was so vital to me. But first I had to figure out solutions for myself first before I could even start coaching other women. So that's been this whole year of this big revolution of my life of finding solutions and then teaching other women to do the same.
So we're talking about perimenopause, but I will admit that I have heard a version of I went to the person who I thought was going to help me, and they did not have the information, weren't willing to listen, didn't have the time, I didn't fit in the box story in so many different ways in my life. Hair loss, earlier things like PCOS, endometriosis, anybody who's gone through the agony of having an autoimmune disease diagnosed, that's a really long diagnostic process, not even due to the fault of anybody. That's very hard to diagnose.
Right.
It's like a chronic situation, and I definitely can't solve it. One of the things that I had to learn early on for myself in dealing with all these things was how to advocate for myself in a doctor's office, which I wasn't very good at. And so that's definitely a thing. So when I was in my young 20s, I worked in an office and there were two wonderful women who were in their 60s. Well, we'll just go with that. I don't remember if that's exactly right. But I remember sitting and having a conversation with them, and they had space heaters under their desk. These were in it was in Cubicle City.
Oh, yeah.
They had space heaters under their desk that were totally not supposed to be there, like contraband office equipment. And fans, 25 fans up above. And we're having this conversation, and one of the women's face just breaks out completely in a sweat. And I'm in my 20s. I don't know anything about anything.
Right.
And I'm watching this and I'm like, what is happening? And then they turn on the fans and they work together, and they had chosen to be in this cubicle together because they were both going through this. They were really sensitive about it. And one of the other women was like, this is a hot flash. And I was like, what? I don't even, but that is literally the only symptom that I had ever heard of until 5 years ago, maybe, whenever I started hearing about it. But you had a lot of pre-knowledge about this, if I can say that, because you do have the medical history and you do. So, but what was the biggest surprise for you in terms of the symptoms and experience as you were going through it?
I think the biggest surprise, which is so funny because I had a coworker a few years ago. She's probably about 5 years ahead of me in age, and she started dealing with brain fog really terribly. And I was just like, and she's she thought she was early onset dementia. Okay. And then after we no longer work together, she finally told me, oh my gosh, I was going through perimenopause. I'm menopausal now. So now now I understand why I had that brain fog. I would say probably the most surprising symptom, for me, was the ear itching. And it was
I've never even heard of that.
Oh my gosh. I would drive me insane. I felt like there was something in my, do I have a rash in my ears? Is there something kind of going on in my, no, it's symptoms. It's just your estrogen.
It's an actual symptom. Your ears might, on the inside, your ears might
on
itch.
The inside, you could take it, your, Q-tip and just and there's still no relief.
Oh gosh. Oh my goodness. All right.
it's all related to your estrogen fluctuating. But yeah, it was so crazy. But even like I developed ADHD symptoms, and it was just like one of those things that was just like, I can't complete a task. It was like squirrel, like every
Right.
like, just
Shiny
so,
object.
yes, exactly. It
Well,
was like,
and just, I mean, you've got three teenagers, so
yeah.
I don't know if you did this, but I would have very much been blaming my children for like
Oh,
distracting
well, they
me.
made fun of me. I mean, it was
Okay.
like, Mom, like you should know this. You keep forgetting, or like, and of course, I would get irritable. And I haven't, my oldest isn't going to be 19 soon. And, he was graduating last May. He's like, why are you just on my case? And I'm like, oh, I guess I am. Like, it's just
Yeah.
irritable with him. And it was just like, we just butt heads. But now it's like, oh my gosh, Mom, you're back to your normal self again. So it was just,
Okay.
but it was a lot of like, it was a lot of, I'm like, for the first time ever, I went through a really deep depression, and I'm like, and that's actually very common for
Yeah.
women to experience depression and anxiety more during this time frame than ever. So, so that was a really eye-awakening experience to have. So,
That was my next question because I wanted to talk about sort of the mind body connection with this, right? Because this is, when I was writing this out, I have to admit this is not actually a really well worded question, but
oh no,
this has stunned me in my grown up experience when it comes to like hormones, right? Because, like, you go through biology class and you go to the doctor and everything is presented like, here's this checklist and these are these physical
right,
symptoms that happen. But like anything in my life that has been hormonally driven, like, puberty, which I can't say I really have clear memories of that very much, but like pregnancy, the first year of motherhood, and then perimenopause, it like shows up in weird ways.
right.
Like my thoughts are impacted, my feelings, my dreams,
Oh my
like,
goodness.
I it's like, whoa, just,
Yeah,
it's like a full thing. So that's like not even really a question, but I think it's like this weird thing that it's not just itchy ears and hot
right.
flashes.
It's a whole body
Um,
experience.
yeah, it's a whole body experience. I think it does. I think it does. All of these things, I think, catch people by surprise.
Right, right. It's so
Um,
funny that you bring up the mind, body, spirit kind of aspect of perimenopause, because I just did a social media post over the last 3 days, like, just showing my evolution of the past year, mind, body, and spirit, and like how it affected each one of those categories. And it's
yeah,
just, it truly impacts everything when I like slow down and really took a look at it. Like it affects your spirit. Like it's just
yeah,
like, because you just feel like this, you're not in that present moment. It's just like this numb kind of feeling of like, oh my gosh. And then you're questioning your purpose in your life. And it's just so many other things. And like once you kind of, it's just like you have this veil in front of you and you can't like see through that veil. And all of a sudden, there's choices, there's, things that you can do out there. And all of a sudden the veil is lifting. I'm like, oh my gosh, I can see the world again, kind of,
right.
clean. So
No, and that's very encouraging. And you mentioned that you are feeling different and you are feeling better, and that is really encouraging. So we'll talk some more about that. The One of the things that I think is confusing about any of these things, like it's confusing when you're watching your kids go through adolescence, is
mm,
that like and brain fog, right? Like, so we've come through the pandemic and lockdown, and brain fog was a thing with people who a lot of people had COVID. Brain
exactly.
fog is a thing when you have little kids and you can't think, like we talk about, the parent brain. And all of these, a lot of these things could be anything else,
Mhm. Right.
right? It's like, consult with Dr. Google.
Right. Exactly.
The
Because it's
way,
easier to go, to consult Google instead of like, make an appointment and like, how many weeks do I have to, wait for this appointment
exactly. And for those of us who are managing like traditional insurance, it's like, when are you allowed to talk to a doctor? When are
right.
you up for your appointment? And then everything is hyper specialized because we do bizarrely separate like female health from like main body health as if they're happening in two separate bodies. Like,
Right.
today,
Exactly.
please treat the part of my body that is not a woman, and then I'll go to the doctor part that is only for
I
delivering babies.
know.
Which is, it's like it made a lot of sense to me when I was like 16. It makes no sense to me now.
Right.
All right. So originally, you already answered this question that I was going to ask you. So like, you went to your primary care physician,
Mhm.
who did the best they could do and left you distraught, and that cued for you, because you're a nurse and you're in the industry, a big personal shift for you to change. But in terms of your own care, did you then just take it over yourself, or what was the journey for getting treatment for yourself? Like, what did you do?
Yeah. I did a lot of research on, okay, I can't prescribe myself, hormone replacement therapy. I can't, like, what are some of the things I could do? Like, the very first thing I started working on was my nutrition, because I'm like,
Because
there's
you
some,
actually, wait, let's pause, because you already had an IUD.
yes, yeah,
So,
yeah,
because that's significant, because the first line of hormone replacement therapy is often, which this surprised me,
progesterone.
right? It's
Yeah.
like go back on birth control, and it's like, I'm sorry, like what,
Yeah. And
It's like,
that whole, like, I think more and more information is coming out. Like, yes, you can still get pregnant during your perimenopausal year. So you do, like, if you're still sexually active, you still need to have, birth control in place, where some people will go, oh, we'll just do the traditional birth control pills, or, oh, you have an IUD, or like you're getting enough hormones with those. Well, it's a different dosage. And I think it's just a conversation you need to have with someone trained in hormone therapy and, OB-GYN or someone like that, to really have that deep discussion about what's best for you in this phase of life. Because I've had clients that they're on oral contraceptives and they're still having a lot of perimenopausal symptoms. And so they've had to switch to a different provider, and like, oh no, this, like, and they've adjusted their, course of therapy based on that.
yeah.
So it's just like, so I think it's a conversation and that you have to have, like, with your provider. But for me, I was just like, I can't live like this. I'm not myself, and I can't show up to be a good mom to my kiddos. And that was like that was like really, distraught me a lot, just because of, like, I need to show up the best version I can for them while they're here, and not with their, while they're in my, presence, because they're going to remember those years, like, mom was crazy, or, mom was like, took time to listen to me, or whatever it may be. So
These were
basically,
mom's grouchy years.
I know exactly. So I remember when mom, like, was on to me about everything, but no, I was just, at that point where I just started researching. I'm like, okay, I'll just do an online hormone clinic. And, like,
Okay.
I just wanted to get my labs done. I'm like, I want to see, like, and
I
that,
never would have thought of that. That's actually a very good suggestion.
and well, and that's is so crazy, because lab work in perimenopause is not often drawn, and it for a few different reasons. Number one, menopause society usually base their course of therapy on your symptoms that you're having, not particularly your lab work. And during perimenopause, your labs could fluctuate hour to hour, day to day. Like, can be
That's what
very,
I've heard.
yeah. And so it's really hard, but, like, I'm a numbers girl. Like, I need to know, I want at least a baseline. So I found a place that was able to draw some lab work on me. And sure enough, and, like, based on where technically I was in my cycle, or was supposed to be in my cycle, and, like, oh, I was low on my progesterone, and I was low in my testosterone. And so this clinic was able to prescribe, those two hormone replacement medications for me. So I started those, like, at the end of March. And then I did another, check my lab work, 6 weeks or a couple months later. And then my estrogen had dropped. And so typically they, like, perimenopause is like that weird stage of, like, do we put in estrogen or not? I think it's a conversation you have to have with your provider. For me, I was having a lot of symptoms. And so they did prescribe that for me. So I'm not big on online hormone clinics, because I feel like they don't look at the whole person still. Like, some places that I've been to, or the place I had been to, they weren't looking at the whole person, because I was like, what about this lab and this lab and this lab? Of course, I'm a nurse. I'm, like, asking about
Right.
all these labs. Oh, we'll just monitor them. I'm like, no, like, this, like I feel like I need to be watching this too. So I ended up, the funny story is, my old OB-GYN that delivered my girls, one of my friends, she goes, oh my gosh, you need to go back to your OB-GYN, because she shared the same one. And she goes, I'm in menopause. I didn't even know I was in menopause. She had no symptoms whatsoever.
You were,
And
like,
she,
so jealous. You were like, oh,
what was your secret?
yeah.
But to me, she was like, oh my gosh, she asked me if I wanted to be on hormone replacement therapy. So she goes, go, like, get an appointment with her. I'm like, sure enough, I went to see her, just do a re-consult with her, because it at that point been like 13 years since I last seen her. And I was just like, she was the first person that took the time to listen to me and validated all the stuff that I was going through. And I was just like the weight that I'd been carrying, because I was like, I have to find solutions. I have to do this. And it was just like, whatever it was, I like that weight was lifted off of me. And I was just like, oh, like I have someone on my side. I have
Oh,
someone
that's nice.
is walking with me on this journey, and like she's okay with all this other stuff I'm on. She's like, yep, I see why you're on it, blah blah blah. She's, I'm not going to adjust anything. I'll adjust it if your lab work warrants it, but she's, I'm not going to take you off of it. You're feeling much better. And it was just like so nice to have that conversation with a provider that listened to you and just like, was just like on your side about hormone replacement therapy. So that, I mean, I did do that. Not every woman wants to be on hormone replacement therapy. And that's completely their choice, or it may not be their choice, but they have to not be on it because of a family history of whatever it may be. But for me, I was lucky. And I'm like, within literally 6 weeks, I was like, oh my gosh, I'm back to my normal self again. It was just like the veil had lifted and I felt so much better. So it was definitely a journey, but I also did a lot of other lifestyle changes too along the way. So
like what kind of stuff was that?
I talked a little bit about nutrition. I definitely watched I think it's super important. For me, the weight gain was, I was becoming more insulin resistant. So I think we don't talk about that enough as we age, especially as a woman, because the estrogen actually helps with your insulin sensitivity. And once that starts fluctuating, I'm like, no wonder why we're losing, or why we're gaining weight in this point of life, because we're becoming more insulin resistant. So I started eating more fiber, more protein. I even started doing the glucose goddess on Instagram. She does never eat a carb naked concept. And so basically,
like not before, like in the morning or at night kind of thing.
well,
Oh no, wait, naked, the carb is, okay. I don't understand. Tell me.
Yeah. So anytime you eat a like a complex carbohydrate, always eat it with a healthy fat, fiber, or protein.
Oh, okay. So
So that
you're
way you
not
don't know
naked. The food is naked. Okay. I went completely the wrong direction there.
That's yeah. So basically it helps prevent that big spike in glucose and it helps you keep your blood sugar nice and regulated for a longer period of time. You don't have that dip in your glucose as much, and then makes you hungry again. So it keeps you fuller longer. But the other thing I did was I also, there's a recent study that came out that if you go for a walk after you eat a meal or use your muscles, it will decrease your glucose by like about 17%. So I'd start going for walks in the evenings after my heavier meal or whatever. And that seemed to work. I increased my strength training. I started walking weighted
Very
fast.
important anyway. Yeah.
Yeah. I mean, you lose 1 to 3% of your muscle mass, which then contributes to bone loss, if you have less muscle mass, but then also contributes to, because you have your basal metabolic rate decreases when you have less muscle. So it's just like this big circle of things. I really worked on my stress management. That was the other thing. And then like, because I feel like there's so many things you can do with stress management, but it's like one of those things, you have cortisol and insulin kind of in the hierarchy of hormones. If you fix those first, it really helps with your other hormones, your sex hormones, your progesterone, estrogen, and testosterone, especially in perimenopause. So if you can kind of work on that hierarchy of those hormones, like the cholesterol or the cortisol and the insulin first, it really kind of helps the downstream effect. And then sleep, which is so funny because sleep is like one of the hardest things for women to really help like adjust. But once I started on progesterone, I was sleeping really, really well. Like after, like I had a more restful sleep. So that was like super important to me. But like before I was on that, I was taking magnesium. I was taking magnesium L-threonate because it was helping me with my brain fog, but it also helps you with your sleep. I was going for morning walks. So when you wake up in the morning, within 30 minutes, get outside, get that, the sun, the sunlight, natural sunlight on your eyes for about 20 minutes in the morning. It helps reset your circadian rhythm to help you for your sleep at night. And then just started doing like, I'm going to do an evening tea before I go to bed, and like a chamomile tea. Just really worked heavily on my sleep. And made sure that I had a good sleep routine down, because that was so important. Even though, prior to going on progesterone, I wake up at like 3 a.m. and I'm like, okay, I have this, and the, just that whole like cortisol awakening at 3 a.m.
Yeah.
I'm just like, what else do I need to but yeah, so it's just like really work. Those are like the four like top lifestyle changes I've really worked on, and really had started seeing a little bit of a difference. But I always start with nutrition with things because that's the foundation for everything to get your
Yeah.
cells working correctly. So
And it is like, for anybody who's listening to this who is like, oh my God, like when you are stressed out, like when you're stressed out and things are not going well, it's like a cycle. Like it's like a
yeah.
self-fulfilling cycle. It's like you don't have the energy and you don't have the brain. And this is not just menopausal, it's just anything else. If you're stressed out in your life, your kids are pushing your buttons, you've got sick parents, whatever, it is hard to take the time and be like, you know what? I'm not going to eat this bag of Doritos or these Cheez-Its. Instead, I'm going to make some food. So there's some self-love in there that's like
Mhm.
finding the time to do it and just picking one piece and doing it. I was at a meeting. There's a networking meeting a month and a half ago, and there was a very young wellness coach who was making a
Oh,
presentation, and she was talking about the value of not having your phone in your bedroom. And I was sitting at a table with like 30 to 50-year-old women, and the person next to me was like, "Oh, excuse me, my phone is right there for the 3 a.m. Netflix binge that happens every single night." And I was just like laughing. I was like, "That is so funny," because
right,
it's like I hear you and also reject it. Doesn't fit
right,
into my
right.
current flow of life. So those are all really, really helpful things. And I am also very amazed that the sleep routine stuff worked when you have a house full of teenagers because I'm a natural early riser. I go to bed very early. And like I find myself, I'm like, if you guys would just get on the sleep routine that I am on so that you're not doing these things like opening doors in the
Oh
middle
yeah,
of the night. It's,
yeah.
they're not doing anything wrong. They're living their lives, like
I would hear my son start the microwave at like
you're right.
9 at night. I'm like,
30, right.
dude, or like he would be like playing video games with his buddies until like 10:30 at night. I'm like, okay, it's because his room is pretty close to where my bedroom is. And so I could hear him through the walls. It's not quiet, at
Right.
all. So I'm
Yeah.
like, okay, you got to settle down a little bit because I need my, but the funny thing is now that I'm like in the sleep routine, my two daughters that are younger, they're now in this routine of like, oh, it's lights out, like it's time to go to bed. We're out this time. So, but then they go down to their room and they stay up for a little bit more, longer period of time. But they're kind of like in this routine now of like, okay, this is the time that mom goes to bed. But it was funny, like when I was going to bed at 7:30 at night, they're like, Mom, what is wrong with you? You were
See, that's
like,
like I'm up at like 5:15 every day. So like
yeah.
8 o'clock moms. I was the ideal toddler mom. We were all on the same schedule. Shortly after that, now it's like, like we have like it's like they have been staying up past me for a long time. So, but yeah.
Yeah, it's so fun. I mean, it's fun how like when they age,
Yeah.
like different sleep routines. But yeah, definitely.
Yeah, no, I remember a couple of years ago, I was like so upset. Like I was like, somebody had friends over and they were talking. And I was so upset. And I looked at my watch and I was like, 11 o'clock. This is a very reasonable thing for them to do. Like I have no business being upset.
Exactly.
But okay. So very good. So so now you've got this business, you're doing coaching, you're doing perimenopause and menopausal coaching and education. What type of nursing did you do before?
So I used to do a lot of bedside nursing for about 15 years.
I don't know what that means.
So bedside means I worked in the intensive care unit,
Okay.
sickest of the sickest patients. I worked in cardiac cath lab. So a patient would come in with a heart attack, and they have a blockage. Like we go in and fix it, open it up, and then they're on their way back to the floor. I did that up until my youngest daughter was born, and then like the on call was crazy because waking up at
Okay.
2 in the morning to rush to the hospital to help someone with a heart attack. I loved it. It was rewarding because you're like, wow, you could see the changes you made, but then it was like 2 in the morning calls were kind of crazy. And then as I kind of changed as my kids aged and became, active, like, oh, now, like, then I started working weekends because then I was like, oh, I can like be with them during the week and the weekends, like I can, do some other stuff. And then then their weekends started getting busy. So I knew, so about 15 years into it, I started transition to be more of a remote nurse. So I worked in healthcare IT. which I love, the organizations I've worked for, but it just wasn't like fulfilling what I wanted to do, like my soul's purpose. Like it just wasn't fulfilling. And like, yeah, it's a great job, like stable, like all this stuff, but like the inside of me of like, this is not my soul's purpose. This is not like, it's like, just one of those things, just like it kept calling me, like, you need to do something different. And that's when I became a nurse coach. And I was like, oh, I just need to get back with like working with patients and people again, of like helping them to create healthier lifestyles for them, for the rest of their lives. And so that was just like that good transition into, going back to what my soul wanted or craved.
Very cool. So we could talk about this forever. I've just got a couple more questions. Okay. So when do you think, as somebody who's doing this now, that people should begin to be educated about perimenopause and menopause? And what type of support, like medical or just otherwise, should people be looking for?
My ideal world.
Yeah, no, like yes, you are queen for a day. Take out your magic
I would
wand.
say women at 35 should start receiving education about perimenopause. What does it look like? Different things, because the average age of a woman going through menopause is 51, 52 in the US. And you could have perimenopausal symptoms 7 to 10 years prior to that. So average age is 51. You can back it up, or go forward to 51, like about 5 years. So that puts you like 46. So that could be like 36, 37. You could start having some symptoms of perimenopause. Usually about 45 is the time that most women go through perimenopause, but you could go in a little bit sooner. So ideally, if 35 would be like, let's start having this conversation about, what perimenopause looks like. These are the symptoms. Here is some information. Let's start getting you familiar with these symptoms and what to do. If I could, I would love to have like women have a baseline hormone panel done.
Oh my
Right.
God. Like, right? Like
Yeah.
why should the first time
Why?
you
I
like,
don't,
yeah,
yeah, I
yeah,
understand perimenopause. Like it's a chaotic mess of hormones, but like baseline at 35, like, because there are like times that women, like, in their mid to late 30s, they may be still having children, or maybe they're done having children. Maybe the hormones are so like completely, you know, chaotic from that, but like, are we back into baseline? Because we want you to be the healthiest you can be prior to going into perimenopause. So you can start that chaotic mess at a good baseline. That's my ideal thing. But yeah,
no, that
so
would
if
be
we,
good. I don't think I've ever had that done. I don't think I've
no,
ever had
oh
that done.
no, oh gosh,
I
no.
had after my kids were born, and other times like I've had like they've been like, hey, we think you should take some of this because it, like your thigh, you've got some symptoms like for like
Right.
after pregnancy, like thyroid symptoms and stuff like that. But
My
I don't
best,
think anybody ever
yeah.
checked.
Well, my best friend, she's 10 years younger than me, so she's 38. And I just talked to her yesterday that, and she just had, she has a 3-year-old and a 1-year-old. So she started a little bit later in life having children, for multiple reasons. But she went to an acupuncturist because she feels so fatigued. And she's like, I'm 38. Like, is this perimenopause? So she went to acupuncturist, and the acupuncturist is like, I don't think your body got regulated after your last pregnancy, which was, well, almost 2 years. February would be 2 years. And she goes, I don't think it's back to normal. And so I wonder how many women, like after they've had childbirth, like their body's just not back to normal and they just need a reset. So
Sure. Yeah.
anyway, I
No,
would
I
feel
mean
like,
it's the yeah. So I had LASIK after my
oh,
second kid,
yeah,
and they made me wait like a
yeah,
long time. They were like after pregnancy and after you stop nursing, like because they like affects the shape of your eye. And I remember like,
right.
whoa, like,
Mhm.
I mean, just so anyway, I know that a lot of listeners are going to identify and benefit from this, even if it's not happening to them, because you just need somebody to put this little earworm
Yeah.
in your ear that is out there, that it's a thing that happens. It's okay to talk about that, all of those things and some suggestions of where to do. Okay, so we're going to do a few more questions before we wrap up. And before we do that, I want to make sure that people know how to reach out to you and about the great work you do as a nurse coach. And you now do functional medicine nursing.
I
I
do a
think
little bit
so.
of that as part of working with my clients. So
And your website is SuzanneGreinerCoaching.com, which we will
yeah.
put in the show notes and in the email that goes out with this episode. And that's where people can find you. You also have a really terrific offer for listeners for the show. So I'm going to share it here and it'll be in the show notes and also in the email. The easiest way to get that is to be subscribed to the fabulous emails I send out. I will describe it because I have it in front of me so you don't have to remember what you told me it would be. A monthly membership, which is called Peri Vitality. Did I say that right?
Yep.
Okay. Connecting women going through perimenopause and menopause, 20% off the first month by using the code podcast. And there's a special link that is like a crazy sequence of letters and numbers. So get that from the show notes or from the email. That's
Right.
very generous.
Yeah. And this community is amazing. It's just women going through perimenopause and menopause. I usually have an educational topic we talk about each month. And I create educational videos for them to watch at their convenience. And we have a couple calls each month that we, have a Q&A session. And the last call of the month is usually our community connect call. So basically it's everyone coming together and like going through how was your month? Like, oh, I'm having this trouble or I'm having this. They love that call because it brings people together that are on the same boat with them and they don't feel alone, which is so good. It's so powerful. And it's just like every month I'm like, oh my gosh, each one of these calls, it's just so we're just in the nitty gritty and we're just all there together supporting each other, which is so important. So.
It is it's the worst feeling to feel like you're going through something and you are by yourself. And it's rarely one of the great blessings of being so connected online is it's not as hard as it used to be to find people, even if you are going through something uncommon. But weirdly, we do all feel very isolated a lot still in a lot of ways. So that's very strange. Okay, so now we're going to end with my 3 rapid fire questions. The great, huge challenge in this is that you're supposed to try and answer them in just a few words. 100% of people fail at that. Okay, so... So I tell you the rules and then I tell you that so far nobody has been able to do it. All right. My first question is about snacks. Are you a snacker? And if so, what's one of your favorite snacks?
Oh, yes, I can be a snacker. And I am it depends on my mood. Sorry. It depends on my mood. Is it sweet or is it savory day?
Right.
I popcorn because there's lots of flavor and popcorn. So
all right, very good. I think I have probably given up popcorn because it's like a never ending flossing project after after popcorn.
The water pick thing.
I'm just like, this is not worth it. It's like too much work. So all right, now what do you listen to watch or to read when you are traveling? So if you're on a road trip, if you're on a train, you're on a plane, is it music, audiobooks, movies, podcasts, sports and news, or do you read actual books?
It's so funny because we're leaving tomorrow to go back to my home state of Missouri to visit my family. I'm a podcast listener for sure because it's I love those sound bites of but I have a lot of audiobooks too. So
they're very similar. So I think that's it. And I think that when I was making the list, I was like, you can pick and choose. Yeah. All right. Last one. If money, time, and location are not an obstacle, right? So we're living in fantasy land. We can do whatever we want. Where would you build your dream house?
Ooh, I love the mountains. And I have this house that was I saw somewhere. It's my dream house. It's where you can have this view of the mountains. But if I were to put that in a place, I would say Montana, somewhere in Montana, have the mountain range view and just have this big, beautiful farmhouse type of house. Just plop it right there so you can see beautiful sunrises and sunsets on both sides. So
that sounds gorgeous. All right. That's it. Suzanne, thank you very much for being a wonderful guest on the Art of Imperfect Adulting.
Thank you so much for having me. It's been a pleasure.
Thank you for listening today. I hope that you enjoy the show. And before I go, I want to encourage you to become a bigger part of the conversation. Obviously, subscribe wherever you're listening to the show. Listen to more episodes. That'd be great. Again, please write a review and tell your friends about the show. That truly is a great help for getting the show in front of new people. Okay, but more fun for you yourself, head over to imperfectadulting.com and join the email community. You'll get some free stuff right away, and that way you'll begin to get the emails about the podcast. This includes the links for the special offers from the guests, and it's the only way to get that. Also, if you aren't in the mood to listen, I actually include an article directly in those emails. Whee! Now, if you love this and you crave more time with me, Amy, as a coach, a mentor, or just adultier adult, numero uno, check out The Village. If you have a story you want to share with the listeners, I'd love to hear from you. I have an open application. Just let me know you want it. And that's a wrap for today. Until next time, remember, the journey is the destination. Ralph Waldo Emerson said that, not me. Well, until just now, I did just say it. But what I want you to hear today is that if your adulting journey isn't going the way you expected, that may not mean that you're lost. It may just mean that you're on your way. This is Amy Stone, signing off. The Imperfect Adulting podcast is created and produced by Amy Stone and Amy Says So. Anything expressed on this show is offered as entertainment, and the views of the guests may not always represent the ideas and viewpoints of the host. That's me. Amy does not intend or hold herself out to provide professional advice or recommendations of any kind. In the end, you and you alone need to make those kinds of decisions based on your personal and individual situation, needs, circumstances, and comfort level.